extra free day. Today we are going to be talking about thigh lifts. I'm Dr. Vidal. This is our Tuesday tips, and I'll get to answer questions after I finish presenting a little bit of this. This is a different one, different format, because I have a lot of pictures. This way I think it's easier for you guys to see the pictures rather than me with the iPad, so I'll appreciate some feedback to see what goes best. So we are going to be talking about thigh lifts because this is a very common surgery in terms of massive weight loss patients. Of course, genetic plays a role, and not only massive weight loss patients are good candidates for a thigh lift, but usually after massive weight loss, we tend to see excess skin in the inner thigh area. The trick with thigh lifts is we need to address the trunk excess skin first. And that is something that is extremely important. I have a lot of massive weight loss patients that are just like, I really don't care about my belly. I just can't wear shorts. I really hate this. The problem is if we don't restore the trunk and lift that excess skin, not only in like the lower belly, but the back and like the hip area, the thigh lift is not going to heal well, it's not going to look good, and it's actually going to look worse. So you can see a pattern between all of this, majority of these cases, or all of these cases, is they all have trunk surgery already, okay? And then we target the lower extremities. That's the best result and the best outcome. And when we talk about thigh lifts, the target is the inner thigh skin, okay? But the inner thigh skin can have different extents. So that's why we have two main procedures, and we're talking about excisional surgery, right? When the severity of the skin laxity does not respond to liposuction only. That's the first step, right? If you don't have a lot of excess skin, more fat, just a little bit or very mild skin laxity, you are a candidate for liposuction with body type, which is rated frequency energy, to target that skin. For this case, the skin laxity is more severe. And actually, liposuction will worsen that skin laxity, and it can worsen the irregularities. So for this type of patients, the best thing is to do an excisional procedure. And it's not just excising the skin, it's contouring the entire thigh. And it's something that you're going to see here in this after results on these patients, okay? There are two main types of excisional surgery when we're talking about a thigh lift. There's actually three, but I always combine one of the options, and I limit it to two, right? We have the extended thigh lift. It involves excision on the vertical plane and the horizontal plane. So you are going to see an improvement not only in the groin area, but all the way to the knee. And it will affect the laxity in the anterior thigh as well, as you can see in this picture, and in this one, and in this one, okay?
I'm going to zoom. I'm not going to zoom in.
Okay, so when you have excess skin, not only here, but you can see it extends all the way to the inner thighs, then you're a candidate for an extended. Extended includes an incision that goes in the groin, and here it goes posteriorly to the fold of the buttock, and then it goes down in the inner thigh just to the knee. And this is the pattern. If you're open, like you open the leg like this is the pattern that you're going to see in the groin and then down towards the knee, okay? It's a scar that is more visible. It is hideable because it's in the inner thigh, so you have to turn your leg for people to see it. Of course, when you're walking, you're going to see that inner thigh scar. But for these patients, they didn't care about the scar because they weren't wearing shorts to begin with. So if you're at that point in your life, you are going to prefer a better contour, and the scar we can treat it, we can laser it, we can do things to minimize the showing, but the contouring is remarkable, as you can see here. It not only removes, you see that thigh gap afterwards, it removes that excess skin up here, but all the way down, you see a better contour in the entire anterior leg, and you can see even all the skin that is sagging laterally, I pull that medially and you see a better contour of the entire thigh. You can see it on her as well, especially this bulkiness in the thigh area here. It extends all the way here, and I do liposuction in all my thigh lift surgeries. And that helps debulk or remove that excess fat all the way and pulling the skin so everything is tighter and contour better. This one as well. This one you have to really take it to like zoom in this area. You see all those irregularities, and she has irregularities in the anterior thighs from the dimpling. And this one, the scar goes here and then in the inner thigh right here and improves all the excess skin in the anterior thigh and also posterior thigh because it's kind of pulling everything in, so you see an improvement here. You're not going to see much of an improvement here in the upper outer thigh. That is from the body lift. So for example, she had a circumferential first, and you see how this bulkiness in the upper thigh hip area improves with the body lift, okay? She did it as well, and she did as well. You can see the scar here from the lower body lift, and all of this lateral hip and upper thigh area improves, okay? The other option is a crescent thigh lift. A crescent thigh lift, it's an incision that is hidden in the groin. So for what patients is this great? Patients like her. She had basically an extra fold and excess fat in the inner thigh area, but just in the groin.
We're very busy here. Busy clinic.
Okay.
Thank you.
So the crescent thigh lift, it just has that excess skin in the inner thigh, but not lower. So you can see, it's hard to see in this picture, but
Let me zoom in. Let me zoom.
Well,
No.
yeah. But what I'm meaning is, if you see all the way to her knees, the excess skin is just up here. So she's a great candidate for a crescent. A crescent is the incision hidden in the groin only. So basically, I lipo all of this area here, all of that, and then put the scar there and excise all that tissue. Pull this up, go like this, pull this up, and the scar is just hidden in the bikini there, okay? So no scars in the inner thigh going towards the knee, just a scar that's hidden in the groin. So if you have excess skin just here and does not extend to the mid or lower inner thigh, you're a great candidate for this. And like I mentioned, I do liposuction all the way down. So I did, and you can see her knee here. All of this was tight, shouldn't have excess skin all the way to the knee. It was just in the upper inner thigh area. So she was a great candidate. We did here in the crease hidden and liposuction all the way down and pulled everything up, hiding the scar there. What are the things that are important in the post-op period for a thigh lift? Number one is you need help, right? This is a surgery that, it's not that it's very painful, but it's a little uncomfortable because the scar is in the groin. So when walking, when moving, when sitting, when going to the toilet, when getting up and down from the bed, it's an area that you're going to be moving, right? So you need help for someone to be helping you, especially that first week, to getting up and down from bed, moving the legs towards the edge of the bed so you don't spread your legs apart. That's an important thing, right? I tell my patients, try to think that your legs are tied up together. So when you're walking, take short steps. When you're moving from one chair or the bed or moving out of a place, try avoiding spreading your legs. Try to do it with your legs together, okay? And that's going to minimize tension on the scars, and tension that can lead to widening or wound openings, okay? The other part that is important is to control infection. It's an area, again, it's near the crease, so we can get bodily fluids in the incision. It's very important to have hygiene afterwards. If on the first days where that scar is very fresh, try to clean and do like a shower after you go to the bathroom, or even with a spray bottle with water, spray the area, pat dry, to make sure that you don't have any bodily fluids in the scars, which may predispose to infection, okay? And the third important thing is lymphatic massages. I mentioned that I do liposuction with all my cases, and with all my liposuctions, I recommend lymphatic drainage massages. But with this type of surgeries, more important. Why? Because it's not only a lymphatic drainage massages in the area of liposuction, but you're going to do lymphatic drainage massage in the entire lower extremity. The lymphatic drainage of the leg goes towards the inguinal lymph nodes, okay? So that area is going to be traumatized from surgery, and the lymphatic drainage is going to be obstructed. So you're going to need some extra help with those manual lymphatic massages to try to stimulate that flow of lymphatic drainage toward the groin where the lymph nodes are, so your body can kind of recreate those channels and it heals without the need of chronic swelling in that extremity, okay? For massive weight loss patients, a lot of them have a combination of venous insufficiency and lymphedema. For those patients, this is more important because you're going to see that your legs are going to get more swollen afterwards, okay? So the lymphatic drainage massages from the leg all the way up are super important. And that's why I'm going to put you in a compressive garment that goes all the way from toe to the upper thigh area for the first week. After the first week, if everything looks good, you are going to have drains. So everybody's very loud on this.
But it's today, right? It's not.
I don't know. It's today. I'm trying to be yelling.
No, we're fine.
Okay. Okay. So I put drains. Okay. The drains usually for the first week, sometimes 2 weeks. Usually after the first week you can remove them, but the lymphatic drainage massages are extremely important. And then after the first week, you're gonna switch to a garment that goes all the way to the waist, and it's like a long pant. Important to get a compression garment that goes just below the knee, okay? We want full compression to the knee level. Don't get one that goes to the thigh only, because then this area of the lower thigh is going to get more swollen. You want compression all the way to the lower knee, all the way to the waist, okay? You're going to wear compression for 6 weeks at all times, and then from 6 weeks to 3 months, you lower it to 12 hours a day, okay? And that's pretty much the thigh lift. I think the other type of thigh lift that I don't really do is the one that is just the longitudinal inner thigh crease. I always combine it with the groin because I think it has a powerful effect on this area here to get that thigh gap and everything feels better, okay? But these are basically the two that I think are the best, and this combination of liposuction with a Crescent is it's powerful, and a lot of patients love it because you can hide it even in a bikini. Okay? I'll get some questions now if you guys have it.
Yes, we have a few questions here. Okay, first question. When can I start laser treatment for scars? And which laser treatment do you recommend?
Very, very good question. There are multiple lasers out there, and it depends on where you're going and the type of lasers that they have available, the machines and the specifications of the machine that they have. But the lasers treat different things. So that's the change in the timing of when you're good to have lasers. By 6 weeks, the majority of patients are ready to have laser treatment. Majority that you are going to be finding useful at that initial post-op period of 6 weeks is like an IPL or a laser that targets discoloration or hyperpigmentation, okay? When the scar starts to get thicker, then we can consider lasers that are more ablative and lasers that are a little bit stronger and deeper in the scar. For example, CO2 lasers or lasers that target more the collagen thickness, okay? Those depends on everybody, but by 6 weeks, most patients are ready for those type by 3 months. So you want a more mature scar to develop, and then by 3 months, majority of the lasers are going to be safe to treat the scars. It's just depending on if it's wide, if it's thickened, if it's dark, if it's red, all of those details, okay? And that's going to determine what laser type is the best for you.
How are results on lipedema patients? I had 1 round of debulking to prepare for thigh lift.
Very good question. So lipedema, it's a condition that causes excess fat accumulation in parts of our body. It is very common in the lower extremities. We see lipedema patients on the upper extremities as well. And lipedema responds very well to liposuction, but depends on the grading of the lipedema. it's the amount of skin laxity that you are gonna end up with after the liposuction. So it's great that you're doing liposuction first, seeing how much your skin retracts, seeing what how much fat you still have behind, and then addressing it with either another round of debulking or a combination of debulking and excisional procedure like a thigh lift. Like I mentioned, I do liposuction with a thigh lift, so that's a good combination. The reason why it's important to sometimes stage these procedures like we're doing, it's because the lymphatic drainage is usually affected in this type of patients. So when we have lymphatic drainage affected already, then the postoperative lymphedema is going to be worse. So it's better to stage it like you're saying at the bulking, and then we see how your lymphedema is doing, how much excess skin we have, and then we determine if we need a crescent or we need an extended thigh lift in your case, okay? How much time you should wait? Approximately 3 to 6 months after the liposuction to have everything healed and see where we're at, okay?
Thank you, Dr. Vidal. Is the pubis also including a tummy tuck?
Yes, very good question. So this area here, and you can see, you can't tell from this picture, but she had what's called monstosis or droopiness of the lower pelvic area. It's very common on massive weight loss patients, and I do address it in every single of my tummy tucks. It is a combination of either removal of that bulkiness of excess fat in the mons, lifting it, tightening, and also anchoring it to your pelvic area to try to smoothen that up. And you see on her, you can't see on the before, but you see on the after how that area is so flat there because she did a fleur-de-lis tummy tuck, and that was before. I also did on her back surgery, and then did the thigh lift.
This is not a question, it's a comment. She said, oh, boy, wait, no, it's here. I just read it. Please. Where is it? I can't wait to see you in September.
Love it. Enjoy the summer, and we'll see you in a few months. Love
Yes. Okay, Dr. Vidal. Liberating patients. Okay, this question is about lipo, and it's how many massages do I need every day? Or do I need massages every day? Will be the questions.
Okay.
I don't know.
So, massages after lipo.
Yes.
At least 20. We're gonna put 21 because I have the rule of 7. 7 times 7 times 7. Okay? So, or plus 7 times 3. I need to redo my math.
Yes.
It's 7 times 3, okay? So the first 7, you do 1 a day for the first week, right? So these are daily for the first week. The second set of 7, you do every other day. So every other day. 1 day massage, 1 day skip massage. Like that for the following 7. And you're there already at 3 weeks out. So the following 7 massages, you're gonna do weekly, okay? And that's gonna give you a total of 21 massages. So around 20, 7 once a day for the first week, then every other day, and then weekly until you finish up.
En español, me hice un levantamiento hace 9 años, pero he perdido 36. No sé si, no sé, 36.
Kilos.
¿Pudiera necesitar otro breast lift? Es que salen varios mensajes.
Ok, pues mira, luego de pérdida de peso y con los años.
Kilos.
Kilos, ahí está. Felicidades en esa pérdida masiva de peso. Súper para tu salud, pero sí, después de perder una cantidad de peso significativa, como son 36 kilos, pues sí tenemos exceso de piel. También se pierde tejido de seno, porque la mayoría del tejido de seno es tejido grasoso, así que cuando perdemos peso en esa cantidad, pues sí se puede ver un poquito deflated, un poquito pérdida de volumen del tejido de seno. Así que sí, la mayoría de los pacientes van a necesitar un levantamiento, dependiendo, hay pacientes que no necesitan tanto levantamiento, pero como rellenarlo, así que hay pacientes que entonces una combinación de un implante con levantamiento si es necesario, pues todo va a depender de cuánto tejido, cuánto volumen hayas perdido, cuál es tu meta de volumen que quieras y en qué posición está tu areola y pezón en comparación a tu pliegue inframamario. Si ya está muy bajito, pues hay que levantarlo y pues probablemente añadir un poquito de volumen.
Mira, Daisy like the life, y yo creo que es de Puerto Rico porque tiene la bandera de Puerto Rico.
Pues más vale que sea de Puerto Rico porque con la bandera. Súper boricua. Bueno, pues nada, muchísimas gracias por haber sintonizado el live. Thank you so much, everybody, for the questions. Hope everybody has an amazing week. And I'll see you guys next week on Tuesday Tips, okay?
Thank you.